Well, good morning, Wesleyan teammates. I want to thank you for joining us in person, or if you're watching this later, we're just happy to be able to connect with you and share with you a little about the updates that have taken place over the last quarter and a little bit about the last year. But I would like to open up our first quarter teammate town hall meeting with a prayer from the Reverend Dr. Eric McKinney. So Eric, if you would, please.
Thank you, Mark. Let us pray. Eternal God, you give us life and you call us to be stewards of your creation, loving all others as you love us. For the privilege of living out that calling here at the Wesleyan, we're very grateful. And we ask your blessings upon all our teammates. We thank you for their commitment, their dedication, their sacrifice. And we thank you too for the privilege of calling them teammates. We ask your blessings as we meet today, that our hearts might be open as well as our minds and our ears. Speak your word to us individually and as a community of servants, that we might show forth your love to all we meet in all that we think and say and do, and make us grateful servants as we share life with our residents, and bless all our efforts that they might be those that you've inspired and you've blessed and you will have used. We ask in the name of the master servant, Jesus the Christ. Amen.
Eric, thank you very much.
Thank you.
Well, we continue to use this virtual town hall meeting method as we have really since the onset of the COVID-19 pandemic 1 year ago. It has in many ways been a very long year and sometimes also feels a little fast. Today we have your administrators, executive directors, and other leadership present on the screen. We've asked them in advance to provide any questions that you or other teammates may have had for this town hall meeting. At the end, we'll open up the floor for any questions that may come up or that have come to them since that request for those of you who are not attending. Let me first start off by saying how thankful I am for this community. The residents, our teammates, family members, volunteers, many others that have been the foundation of support for the Wesleyan family throughout the pandemic and straight into the worst winter that many of us have seen in this area. The incredible selflessness of this community and looking out for one another is one of those examples that makes the Wesleyan so unique. Teammates were checking in on residents, obviously. The residents were checking in on their neighbors, and residents were checking in on the teammates. As one resident council member from the Independent Living stated, they're not just our neighbors, and they're certainly not just our employees, they are our family. So we know the depth of connectivity across this community, but it is also good to not only we recognize it within ourselves for those we serve and those we serve with, but also to be recognized outside of this community. So I wanted to share with you that this past week, the Wesleyan was recognized as the Georgetown Chamber of Commerce's 2020 Large Business of the Year. This is the first time the Wesleyan has been recognized by the Chamber in this category. It was incredible to hear how Georgetown has valued this ministry and your work since its beginnings nearly 60 years ago. We do have a recording of the presentation and acceptance, and we've shared that through social media and our website. We'll be doing that on Touchtown as well. But I want you to know how much we appreciate you and thank you for being instrumental in the Wesleyan receiving this recognition. Now, I think everyone's probably tired of talking about it, but we do need to spend some time talking about COVID-19. And I want to say this, many of you, the administrators and leadership have been on our other town hall meetings, and not all of them necessarily, and there is some commonality, and that's because we want you to hear what we're also sharing with the residents. That's important to us. This is one community and we want you to hear that. So I know this is repetitive for some of you, but it's important that we all know the same things across our organization. But we have received a number of questions about specific to COVID-19, about how we're going to change policies and procedures and how we might be progressing through this pandemic. And it does, in fact, remain a pandemic. That hasn't gone away. I did ask a couple of our teammates to review some information, and Kelly Getz, our compliance officer, is going to talk a little bit about some of our initial responses, and then also the fact that we are planning for future updated guidance. Slowly but surely, agencies are releasing information, not necessarily together, and so we're just going to have to give you updates as we get more information. But the Wesleyan is in contact. Many of you are as well, with local, county, state, and federal health and regulatory agencies daily for updated guidance and best practices with regards to COVID-19. Now, it probably will not surprise you that that guidance being communicated or possibly even pushed out to social media is not always consistent with each other. At times it's out of date, and sometimes it's also contradictory with one another. Now, we do have these subject matter experts and through our teammates, people who are able to navigate this information and glean what is mandated, what is preferred guidance, what are best practices. And then we kind of gather all that together, and then we use that information and experience to help us apply policies and procedures that are important to our campus. Now, that being said, what many residents, family members, and staff have asked us how we're going to respond to the new guidance that has been recently shared by our governor. So let me first make this foundational comment. First and foremost, the policies and procedures of this campus are focused on the safety and protection of our resident and teammate population, along with the volunteers, essential visitors who come to our campus. Some people have said that our policies are too restrictive. They're just too much. There have been others that have said that our policies are not restrictive enough. Most of our community, that's residents and teammates and family members, fall in between these comments, but everybody understands their role in safeguarding not only themselves, but their neighbors. Our ability to be successful in keeping COVID-19 at bay is the continued teamwork that we have developed with all of you, our residents, and our family members. We will adjust our policies to reflect new mandates, and we will consider new guidance as we discern next steps. What I can guarantee you is things will change. That's what we do know will happen. Now, some of those specifics included, but they're not limited to, the continued encouragement of mask use, hand washing, and physical distancing for our residents, as well as reducing the need for screening for some of our residents, modification to their travel guidelines, and phasing in various openings across our campus, dining services, and such. For teammates, we are mandating the continued use of masks and other PPE where instructed. And that's for your protection as well as for those that we are coming into contact with. We know that it's not comfortable. We know that it's been challenging. And we know for many of you, it has been a very long time to go without masks. We know that. But as we do this, our investment will not be in vain. That we will be able to take these next steps and eventually get to the point to where we don't have to use them. We know that that is in our future at some point in time. Now, we are excited to see the improvement in our community's health so that we can begin moving towards what we define as a more normal operation. But it's important for me to make this caveat. While those really horrible numbers that we've seen of new and existing cases and deaths due to COVID-19 have declined, in comparison to what we've experienced over the last 4 months and really since a year ago, the numbers we have today are not good. It's great to celebrate decreasing percentages, but for those who've been impacted by COVID-19, residents, teammates, their families, even one person is too many. Now, on the Department of State Health Services call that we had this past Tuesday, the state was reporting just over 30,000 new cases and 1,800 new deaths attributed to COVID-19 just over the past week, just for the last week. Now, what does that mean? As numbers climb, if we see a resurgence due to variant strains or other unpredictable trends within this pandemic, we will, as we have, revisit our policies and procedures to be proactive in protecting our residents, our teammates, and all of those who are integral to our campus. Now, when I talk about who are we, when I mean we, I mean this community, I mean Georgetown, I mean Williamson County. Williamson County is still in phase red, and that is defined as uncontrolled community spread. It's a scary definition. Our numbers are better, but only compared to the extremely high numbers that we had been experiencing over at least the last quarter, if not longer. Williamson County, the numbers and percentages that are being reported are only for those that are eligible Williamson County population, defined as 16 years of age and older. The state is reporting that that estimated population is about 458,000. So not the totality of Williamson County, but a subset of it. As of 11 p.m. last night, only 8.1% of that eligible population has been fully vaccinated. That's only 37,000 people. 37,000 people out of 458,000 that have been fully vaccinated. We haven't even hit 20% to have received their first vaccination. These are, I don't want to undermine it because these are good steps. These are good steps, but we are far, far from done. We are concerned, and we heard this on the call this week, about a predicted surge as a result of spring break. Children being back at home, children or families traveling. They are expecting a resurgence. Just like we saw good numbers before Thanksgiving and Christmas, we then saw that resurgence. Our protection, our diligence will help us during that anticipated time of increase. Now, the CDC has also released updated guidance. It begins to outline how those that are vaccinated can start modifying their restrictions in their households. However, guidance from those health agencies still promote in all public settings mask use, hand washing, physical distancing. It's all highly encouraged, except for in those places where it's mandated. And of course, we have to follow the mandates of those organizations. Our community has different policies and procedures. That's because skilled nursing and assisted living and in home community-based settings, when there's clinical activity going on, they're mandated. In other areas, it's not. We still take a more restrictive, highly encouraged approach, but you will hear difference in languages. If you're one of those that is in one building and then potentially another one that week, you're going to have to know that there are different policies and procedures. Now, I'll share something with you because it's a question that every population, family members, consultants, residents, some teammates, they've asked, Mark, are you pro-mask or pro-vaccination? Do you support more restrictions or do you support less restrictions? I had this conversation with the Chamber of Commerce yesterday. And here's my response. I am a steward of this ministry. That means I'm a steward of the residents and yours. So to that end, I am pro-resident. I am pro-patient. I am pro-teammate. I'm for the highest quality of life that this community, the entire community, can achieve in a healthy and safe way. Which means we're going to have to update and change and be flexible in all of our policies and procedures as we continue through COVID-19. What I ask of you is to continue to work with us to take these next steps together. We don't want to spread concern. Certainly, if you pay any attention to the social media, it is riddled with misinformation, with good information and bad information, misinformation, wrong information, just fiction. And frankly, the fiction is actually more entertaining than the truth, but it's not real. And we don't want to cause anxiety amongst those we're serving with or those we're serving. So in addition to COVID-19, we've also experienced a winter phenomenon unlike any in the recent history of Georgetown. And I was watching social media and people have called it Snowvid, Snowmageddon. Heard someone today call it St. Valentine's Day winter something. Regardless, it was harsh, it was unforgiving. It impacted our nation, our state, this community, each and every one of you. I want to again pause and give you my praise for those who came in, who jumped in, who took the opportunity to help your neighbors, your teammates, our residents, watching out for them and making sure they were okay. You, our teammates, once again stepped up and showed your heroic commitment to this community. Many of you worked 24 hours straight and then some. You slept over in the buildings to make sure you were here to provide care and services. You traveled treacherous conditions because you knew that you were needed. It's amazing. We heard stories during that time of neighboring communities that abandoned aging communities, retirement communities. Residents were left to take care of themselves. They didn't have access to food or blankets or even communication with the outside. And these things reminded me that to our teammates, this is not just work. This is home. This is a family. Each other. You are your family. And you care for each other deeply. And we are thankful to you. The leadership of Wesleyan was proactive in coming to me and arranging for emergency pay on top of the routine wages for the staff that were on site, for those who worked full shifts, that worked in addition to, and we also were able to provide meals and sleeping and bathing accommodations because many of our teammates were without power and utilities and still were here. Now, we are going to have to do an after-action review of the emergency over the next few months, and I think that's the right thing to do. There were many, many things that went well, but there were some things we could improve upon. As we look back and we find the opportunities to further develop those plans, and God forbid we actually have to use it, we do need to have plans. We do want to have your input on what went well for you as a teammate and what areas could be improved. Things that you may have seen, not even in your own department. We want to hear from you, from your perspective. Please talk to your administrators and your leadership team to get that feedback to us. This is going to be done at every building, through every program, to impact how we're going to manage emergencies campus-wide in the future. Now, for all of you, I know there continues to be a great interest in the strategic plan of the organization. I was sharing that I confess it's very odd to think about all that we have to focus on each and every day with COVID-19, with the winter storm and the aftermath of the winter storm, and OIG surveys and state surveys and infection control surveys and more surveys with other names and other surveys. It's a lot, but it is important for this organization. It's healthy for us to look, as a growing organization, to look at the future. So as I've shared before, all of the pre-construction work for which we engaged our development firm and architects has been completed. It's done. Now, normally our next step would be to proceed into a financing stage of construction. However, COVID-19, this resulted in the lack of available contractors to provide work, rapidly increasing costs of materials and supplies, not just because we wanted them or the ability to transport them to us, but in manufacturing as well. The unavailability of material supplies and then the lack of availability of labor caused us to take a step back. And I want to say that that's a step back and a postponement. It's not a canceling, but to postpone our moving forward where it made more sense operationally and financially for us to look at some other time in the future. Now, one example of this I've been asked is that may be a little bit more relatable. About a year ago, a 2x4 was a little less than $2 a piece. Today, even with the group purchasing that we do and getting steep discounts, those costs are nearly $7 a unit. So you could imagine, that's a 350% increase. You could imagine what a 350% increase in materials and labor could mean to this project, as expansive as it is. But I want you to know that our board and leadership team are still supportive of the elements of the growth plan and are communicating that with our development firm and our financial consultants. And we're looking at the most productive window to get this project moving forward. Now, just to remind you that the elements of the project at this time continue to include expanded independent living facilities, more assisted living care, especially in memory care and support, adding to the Wesleyan skilled nursing with Alzheimer's and dementia care services, doing a welcome center that will bring all of our home and community-based services and our corporate staff and others to one centralized area, a campus maintenance building, workshop, new walking paths, lighting, landscaping, clearly much needed parking. And then also tangential to that project is the continued pathway that we're taking with the donor project regarding a hospice center here in Georgetown, which will reshape and reconfigure our home and community-based services for hospice and home health. Now, it's a lot, and we're going to continue to keep you updated on what's going on and when those next steps will be taking place. We are going to be taking our next steps with renovation of the Independent Living West building, which is long overdue, and you'll see some of those projects taking place as well as a reconfiguration, something we know our residents and our teammates will be happy about. That will include some reconfiguration for our home and community-based services to allow for that presence to continue even after we move into our project for the hospice center. Now, we've talked about a lot of heavy topics, but before I wrap up, I want to address something else that was brought to my attention. I'm going to ask Laura Kate and Donna and others, Eva, to share with you just some of the comments that have come from their residents, comments of praise and thanks for all of you. But I want you to know how much your residents and patients care about you. One of those wrote a note, and they just said this. They said that our teammates all across the Wesleyan at all different levels have very high standards in serving their patients and residents. And we appreciate their attention, especially in light of COVID-19 and the storm and all the needs and wants that we have. My question to you is, are they paid on a just scale for those expectations put upon them? And I wanted to share with you the response that I provided to each of those programs. The Wesleyan does everything it can to remain competitive, not only in our salaries, but also in the benefits that are provided to teammates. We offer health insurance at many different levels, which many organizations don't do. And we have increased those benefit plans and at times have been able to reduce those premiums. When we have had an increase in premiums, the Wesleyan took on the burden of those increased costs and did not pass it along to our teammates. We have an incredibly generous 401k plan, especially compared for our industry. We subsidize training and continuing education. We have continued to provide annual increases. Now, that may not sound unusual, but not only have many communities like ours not provided increases over the last year, and many more years beyond that, many have had significant layoffs where we have not had to. We've provided free meals over the last year. And while this can't continue indefinitely, we will maintain low-cost meals, just like we had prior to COVID-19, as well as steep discounts in other meal programs like our bistro. And these more than compete with local fast food and the conservation of time and being able to have more time on your break. We have actively pursued the support and funding for tuition reimbursement for teammates who are seeking further education and have teammates that are receiving that now. And in addition to the emergency pay that was provided during the winter storm, teammates that were working in COVID-19 exposed areas received additional compensation. The Wesleyan monitors and evaluates compensation levels across our community and industry routinely. To that end, we've had departments company-wide that had base starting and level of experience wage increases just starting this last month. I'm going to continue to work with our team on new ways that we can make the wages that all of you receive stretch further. We're going to continue to negotiate for better benefits. We're doing a feasibility study for a potential workforce housing on this campus to make it more affordable for teammates to live and work in Georgetown, as well as add additional services such as lab services, possibly nurse practitioner or physician services, and working with the community to bring services not only to our residents, but to you on this campus. I know this is a lot of information, and I appreciate your time and attention to this. As I was mentioning earlier, Kelly is going to share some specific comments with you regarding some of the revised COVID-19 practices for our teammates, and then we're going to open up for some additional questions. But thank you. Thank you for being teammates that I'm proud to continue to work with and in serving the people that have been entrusted to our care. Kelly, would you like to share a couple of things with us?
Sure. Good morning, everyone. So Mark had mentioned a lot of different changes in policies and procedures during the pandemic. And there's one thing with COVID-19, it's always been hard to determine what's the next step. So with all of the different policies and procedures that are coming down, PPE is still one of the most important things to utilize when we're caring for our residents and our patients. Each entity, each community will have a little bit different rules as far as the PPE that we utilize. One question that came up that I wanted to share with you today was the utilization of eyewear. Are glasses considered eyewear? And unfortunately, glasses give you a level of protection, but if you come in contact or potentially come in contact with someone with COVID, it's essential that we use appropriate eyewear. So gloves and gowns and 95s are pretty a pretty simple practice across knowing what we have to wear when we're taking care of someone. But if you come in contact with someone that is not utilizing a mask, and now at the independent living, the residents do have the choice to wear a mask or not. If you come in contact with the resident or patient and they do not have a mask on and you do not have protective eyewear on, you are considered a high risk exposure if you've been around that resident or patient for 15 minutes or more in a 24-hour period. So with this being said, we also want to make sure that you have comfortable protective eyewear on over your glasses if you excuse me, if you utilize glasses. So please get with your administrator. We have several different options of eyewear that we can use. So please check with them and make sure you have one that's comfortable for you. But anytime you come into contact with anybody in the buildings, a resident or a patient, and they do not have a mask on, protective eyewear needs to be utilized. And the other thing that does for you, if there is a potential exposure, we've done a lot of contact tracing over this last year. If there is a potential exposure, you are considered low risk, so you are still able to work. If you do not have protective eyewear on when you come in contact with someone that has COVID, it does put you in a high risk category. Even receiving your vaccination right now, as of today, that still does put you in a high risk category. So, like Mark mentioned, there's changes coming every day. And I commend and would like to thank each of you. I know that we are rolling out a lot of different policies and procedures continuously. And so there's going to be more to come. So please, if you have questions, reach out to your administrator. You can always reach out to me. And one other thing I did want to mention, like Mark had said, the policies and procedures may be different. Some of them now at different communities. So if you are a teammate that goes to a different community and an administrator shares with you, well, this is required here. If you have questions, ask them why. If it's a moment for you to get educated and learn the differences. So if they tell you it's required, and we please ask that you abide by those rules in each community. So always feel free to reach out. Thank you from the bottom of my heart for everything y'all have done this last year. There's one thing this last year we've learned that we've always known, but it's a true testament that we will get through this together. Thank you.
Kelly, thank you very much. Bethany, anything you want to share with us?
Good morning. I did just want to share that I have been on each town hall meeting this week, and each of those had residents on them, and the compliments that those residents gave on each call, I want to make sure to reiterate. We've received a ton of emails, phone calls, letters, and then the verbal praise given on those town hall meetings of just how thankful our residents are for each of our teammates. Even when they're questioning some of the restrictions we have in place, they're still very thankful for living in a community that focuses on their safety. And they're very complimentary, and they do consider each of you a part of their extended family. So I wanted to make sure that you know that the service that you provide every day is recognized and very much appreciated, not just by your administrators and your corporate support team and your fellow teammates, but also those that you serve every day. So thank you all for your continued hard work and dedication.
Bethany, thank you. So do we have any questions that we didn't answer? I know we talked about a lot of stuff. From our administrators, any additional questions that we might have? No. Shaking heads, no. All right. Senior leadership, anything else y'all want to say? No. All right. Well, a couple end comments to that I will share. Because our residents care very much about you, they want you to be comfortable. They're going to tell you it's okay to take their mask off if you're helping them. You can't. It's very thoughtful, but they will, and you can't. But it's very thoughtful. They're kind, and they want you to be. They want you to start feeling comfortable. Our resident population, our teammate population, our family population. It's like I referenced when I was first talking about information on social media, and that is we have a wonderful diversity of opinion about all that's taking place. We have those that still adamantly believe that COVID-19 is a hoax, believe it or not. I still hear that up till this week. And that's hard to hear. It's hard to hear when you think about all that you've done. There are those on the other spectrum who are anxious, nearly paralyzed with fear over it as well. And that's hard, difficult for you and them. And again, like most of us, we're probably somewhere in the middle. It probably is a little bit more impactful when it impacts us personally in our family. I know that it impacts you all. I've talked to several teammates through tears that have had difficulty at the loss of a resident or a decline of a patient. We want to start hearing from you. I've talked with several of my colleagues in our state association. I feel very strongly that we need to talk about what post-COVID-19 is going to look like. What kind of counseling and therapy support do we need? This is traumatic. This has been tough. And even though you are all called to this type of ministry, callings are not easy. Actually, historically, they're very difficult. And we need to recognize the fact that this is serious. And it doesn't matter what you do in the organization. It's all critical, every bit of it. And so it takes each and every one of you to make what we do work. And so even if you're not on the front lines, you're doing something to make and ensure that person can be. So think about it, be honest with yourself, talk with us. Jen, I know we have employee assistance programs through human resources. Administrators be the conduit for that. If there's something that we haven't done that we can do, let us know. One resident at the very end of the meeting said, I wonder if you have challenges that other businesses do. And in a lot of ways we do. This person herself is a lifelong businesswoman, but also married to a minister, and said, it's difficult, isn't it, being both a business and a ministry? And it is. If you look at your administrators, I would guess that is a challenge every single day. We don't ever want to lose sight of the fact that we are, in fact, a faith-based ministry. That is important. It's why we're here. But if we aren't a strong and effective and courageous business, it can't be a ministry tomorrow. And that's a challenge. We don't want to go too much one direction or the other. And it's so therefore, like with many things, it's a balancing act. So we need to hear from you. I know we asked that, and I will tell you what I told the residents. I think it's great that we have these town hall meetings. I think it's wonderful that questions can be asked. This should never be the only time you ask questions. It should be one major time where we kind of reconnect. But ask questions, talk to your administrators, share with us what we can do. If it's not been done before, don't assume it can't be done again. We need to continually reinvent ourselves and figure out new ways to do new things. I want to thank you again for taking the time. I want to thank you for the work that you do. I want to tell you that this community cares about you, not just the residents and family members here. Georgetown cares about you. We're coming into 60 years of ministry next year. Now, I don't think anybody has been here from the very, very, very beginning. But many of you have been here from very close to the beginning, and that is amazing. But the breadth and the success of this ministry is in all of you and in your hands and the feet and the work that you do. Thank you very much. Have an incredible week, and God bless.